Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwanitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Hey, welcome back to Between the Sheets. I'm excited to have you here today. Thanks again for listening. I have a guest with us today. She is a sex and relationship coach. This is Charlotte Bevers, and she specializes in working with men and couples. She has a special focus on strengthening and repairing relationships. Charlotte's coaching provides the tools, insights, and strategies to enhance both emotional and physical intimacy. She explores topics like needs, desires, attachment styles, and boundaries in a way that fosters growth and connection. Understanding the vulnerability involved in discussing sex-sensitive topics such as desires, sex relationship conflicts, and self-esteem issues, Charlotte offers a safe, confidential space for those conversations. Trained in level 1 couples therapy with the Gottman method and as a sex and relationship coach through the Somatica Institute, Charlotte partners with clients to build stronger, more connected relationships. Together, you'll break through barriers, heal past wounds, and tackle challenges related to intimacy, trauma, societal messages, and self-sabotaging behaviors. By building individuals and couples towards deeper connections, self-love, and renewed confidence, Charlotte creates a compassionate and inclusive space where curiosity and understanding lead the way to lasting change. Welcome.
Thank you so much for having me. I'm excited to be here.
Yeah, I'm excited to have you. And I'm really excited that you not only work with couples, but you also work with men, which I think is a really interesting side of things that we haven't really gotten too deep into yet on this podcast because, I deal with both from a medical standpoint. I deal with both men and
Right.
women. The few sex therapists that I've had on here have either been couples or more geared towards women. So I'm really excited to have you on here and kind of talk through some of the issues that our men deal with and how we can help them.
Yeah. And that is one of the reasons why I love doing this kind of work is I think there isn't enough conversations being had geared towards men and what they struggle with and what they face and deal with on a day-to-day basis around relationships and around sex in general. So I'm
Yeah,
excited to
absolutely.
share.
Thank you. Thank you. Yeah, definitely the pressures, the stigmas, the stereotypes, all of that are very different between men and women that in a relationship and related to sex and all of those things. So talk to me about kind of when men come to see you, what is their initial reason for coming?
That's such a great question. It varies a lot
Okay.
depending on the person and what's going on. It depends on if they're single, if they're partnered, if they are newly married, if they've been together for 20 years. It really just kind of varies depending on that. But what I see a lot of is men not feeling understood and really seen in their sexuality and what they want, in being able to communicate those things. I feel that a lot of them come in with a lot of shame around wanting certain things or expressing needs and desires, not only in the relationship, but in the bedroom. And it just, they're typically their female partner just being, not knowing how to react or deal with that. And so there's a lot of negative things that get said to them. And so they may not initially have shame around things, and then they come in with that. Or they're trying to find other ways outside of their relationship to get certain needs met. And, that's probably the biggest thing that I see across the board with men that come to see me.
So if along those lines, is it a lot of maybe they don't have as strong of libido as their expected to, or they are not the ones initiating, or they're initiating too much? What are kind of some of their biggest issues as far as like, I guess those self-confidence reasons?
Yeah, no, that's um, it. So much of it is all the things you actually just said.
Yeah.
It's being expected to perform and being the person in the relationship that wants sex all the time,
Mhm.
and being the person that is supposed to initiate. I know I get a lot of, I'm so tired of initiating. I want to
Yeah.
be chased, or I want to also be pursued in that way. I
Yeah.
want to feel desired and wanted from my female partner. I don't want to have to constantly initiate. And understanding too that, um, like you said, the programming that we each get taught as different genders is that, men are supposed to always want sex, and no matter what's going on, they should just be able to, get hard and be ready to go. And that is just not the case. There's a lot of
Yeah.
things that play into that. And one of the big things that I see too, and kind of sidetracking, diving into some of this, is a lot of men come in thinking that they have ED,
Mhm.
erectile dysfunction. And true erectile dysfunction usually means that you have an issue with your heart, or you have
Yes.
high blood pressure or high
Mhm.
cholesterol. And it's an actual physical thing that is something is not right in your body.
Right. Right.
Um, and we treat that in our society all the time with pills and things, when a lot of the times it's actually a psychological issue that is
Yeah.
what is really going on. And so I have to have that conversation too, where I'm sure you see a lot of that as well, just in your day to day
Yeah.
world.
Absolutely. And a lot of them do. They come in for, hey, I just can't get hard. Or one of the biggest questions that I will ask to kind of pull apart whether this is physiological or psychological or a combination is, can you get hard with self pleasure versus with a partner? And if my guys are waking up with morning erections, they're getting spontaneous erections, and they're getting good erections with masturbation, but not with intercourse, then I'm sending them to you. And I'm
Yeah,
saying, okay, I might give you a little something to give you a little confidence boost in the meantime. But I'm not the right person here. I need you to go see a sex therapist, because there is more going on here than physiologically not getting the blood flow.
right, right. Yes, yes,
So,
exactly.
what are some things that you talk to them through? How do you help them work through the psychological side of ED?
So I usually start out just being really curious,
Hmm.
and I ask a lot of questions. I try to get to understanding what their everyday lives look like, what their relationship looks like, if they're single and dating, what that looks like for them, and if they're partnered, um, again, just what does the relationship look like? What do you have a lot of conflict? What's being said to you? How is your interactions? And I really spend so much of my time just being really curious and asking a lot of questions, trying to understand the full story.
Yeah.
Because I'm not someone who is a one size fits all. So I don't have some, bulleted list of like, okay, I'm going to do this, 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 because
Yeah.
everybody's different.
Sure.
And so I'm really there for individual needs. So
Yeah.
um,
No, that makes
versus,
sense.
yeah, yeah. I mean, I just
Mhm.
don't. There's no cookie cutter way to do
No,
this.
there's there's not. That's for sure. So what are some of like the main themes that you're seeing? Like, is it past traumas? Is it more outside of the relationship, like work and finances stuff? Is it more inside of the relationship? Where are these guys really getting their struggles?
Um, I think the two biggest things that I see are societal messaging, uh, and their relationship dynamic are the two biggest
Yeah.
things that I see. I know that men, the way that we teach boys and men around emotions and feelings and being able to express yourself. It gets shut down so often as little boys, and teaching them that they can't show weakness in any kind of way. So that's if they're not feeling a certain way, they have to stuff that down and they can't express it. And that shows up in so many ways. It shows up in your conflict, it shows up in the bedroom, and also just the soul, and then just the dynamics of, excuse me, the dynamics of the relationship and how someone gets treated and what the partner. I am so sorry, my voice is going.
That's okay.
How, like I said, the dynamic of a relationship and how someone is being treated. I see a lot of times men, like I referenced earlier, just being tired of being the one to initiate, or not feeling wanted by their partner and always having to show up in that way, and it shuts them down. And or expressing a certain need, like, oh, I would really like to try this, or this is something that really turns me on, and I would love for us to try to explore that. And just, again, not being received in an open way, and someone wanting to pursue that. And so those are the two biggest things, is the messaging, and some of that comes from religious backgrounds as well. I know that religion can play a huge role in how someone has grown up and shaped their thoughts around masturbation or just sex in general. So I have to deal with that, along with the societal messaging of I'm the man, I have to perform, I have to, a woman's orgasm is my responsibility, and it's all on me to show up this way and be ready to go like that. And it's just not. And something I love to say is that great sex isn't about performance, it's about presence. It's about being curious, it's about open-mindedness, and being able to come into that space without all these walls and all these preconceived ideas. And that can be really, really challenging for all of us to do.
Absolutely. Well, it's a very vulnerable part of your life in general. And then when you're trying to mix it with another person's vulnerable part of their life, and both of your pasts and histories and all of that, it's a lot.
Yes, it is a lot. It is a lot. And we don't get educated on how to really navigate that, how to have conversations, and how to come together and say, hey, I know you have your stuff and your past experiences, and so do I. And how do we come together and talk about these things and work through them, and in a way that we have a really good, healthy relationship and a great sex life as well.
Yeah, absolutely. So, and I know these are all very generic, right? I know that you are phenomenal at individualizing things and whatever. And so today is really generic, but what are some tips that you give your guys for going home and having these conversations with their partner? Because it is difficult to bring up. And like one thing that popped into my head as you were saying, when he wants to try something new, is the woman receptive to that, or is she going to be pulling out the, well, where did you see that, and who did you try that with, or did you see that on porn? And trying to just prepare them for these conversations.
No, I love this question. It's such a great right thing. So I come back to, well, I will start with this, is we actually practice this in my sessions. So I try to help them have these conversations while in session, so that they can kind of get a feel for what it feels like in their bodies, and just to speak these words out loud to somebody. So we practice working through scenarios of whether it's a new partner or their current partner. And it's really just working on the vulnerability piece of coming and saying, hey, I care about you. I care about this relationship. And I want to share some thoughts and feelings I'm having around these things. And I would love for you to be receptive to this, and I want to hear your thoughts and feelings too, but this is where I'm going to start. And even just saying that out loud can be so different and foreign
Yeah.
for
Yeah.
somebody to, especially a man, to come and say that to a partner. And it's
Well, I'm sure
just
for some men it's even difficult to come and see you initially because the
absolutely.
stigma with going to therapy as a man can be a barrier.
Absolutely. Absolutely. I run into that a lot. It's honestly one of my biggest challenges. It's
I
really
bet. I bet.
um
I'm a huge proponent of therapy. I love having therapists in my life. I love telling my patients to go to therapists. Like it's just it helps in so many ways. Just your entire life gets better in therapy. So I'm a huge proponent of it, but I know that there is this, and hopefully we're pushing through this stigma, but there is still this, oh, you need therapy. And then especially as a man, because you're just supposed to be the provider and the macho guy.
right.
And so I can imagine that just initiating therapy must be very difficult for some of them.
Absolutely it is. It is. And it's something that I don't take lightly. I very much I love doing this work and I believe in it wholeheartedly. And anytime I get the chance to work with a man or anyone,
Mhm.
it's such an honor and a privilege. And I do my very best to make them feel as safe as possible because there is no 100% safety in being vulnerable, but I try my best to provide a safe space and where there is total confidentiality and
Mhm.
no judgment, and I'm just here for
Yeah.
them
Yeah.
for
I love
sure.
that. That's awesome.
Yeah.
Yeah, and I like the practicing the conversations because it is difficult to find the right words that you want to say and talk them through. And the last thing you want to do is be in this vulnerable situation and be fumbling through your words and it come out wrong. And then you're like, well, shoot, now I got to re-say that. And I'm upsetting this person and I didn't mean to do any of that. And now, like, how do we get back on track? It's
Yes. 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 So, and that's why I really love the practice part is um, because I'm also a somatic coach. So I bring a lot of the body techniques into it. So it's not just
okay.
it's not just talking and processing. You're actually working with your body. And so it's breathing. It's paying attention to what comes up when you start a conversation or when you notice that you're being vulnerable and you see someone's reaction, what's happening in your body and how can you get back to a state of regulating yourself as you continue to have these kinds of conversations,
Yeah.
which is a whole other component that we don't learn or talk enough about.
Yeah.
So
Absolutely. How do you help men who don't feel desired because they're the one that's always initiating? How is that conversation when you send them back to their partner to say, hey, like, I need you to step in more and I need you to, do you talk about being, I don't know, what do you talk about?
yes, so I also offer the idea to have their partner come in and join me.
Oh,
Um,
okay.
so I do offer that as well if their partner would be open to it, or
Hmm.
even sending them and I could do a session with just their partner
Okay.
and then kind of help in that way as well.
Yeah.
Um, but a lot of it again comes from just continuing to be curious and help them show up in the most vulnerable way because I
Yeah.
think the more vulnerable that you can be, the more receptive a partner is going to be. So if you can just be honest about what is happening and what you're really wanting instead
Yeah.
of coming at somebody in a way of like, oh, I want to try this and normally you say no, but I really need you to hear me. Like
Hmm.
that's not going to work. So it's
Yeah.
really trying to um, help them also get a perspective of how what they're going to say, how it might land for the other person. So that's part of the practicing conversations and what that looks like. So that I mean, we even practice sometimes, like maybe I make a weird face or something to
Hmm.
practice what it might be like if their partner shows up and is like, not receiving what they're saying well,
Sure.
and how they would navigate through that as well on their end of things, because obviously we can't
Okay.
control how someone else receives something or how they react or not react, but
Yeah.
you can control how you reset and come back and really feel into what you're trying to get across. And
Yeah.
so that's mainly what I do.
Yeah, and then do you also have to help them kind of get to the root of the no on the other side? Like if you're saying, "Hey, I really want to try this," and your partner just says no, do you encourage them to kind of talk through that no and figure out the why behind it so that maybe there's some negotiation there?
Absolutely.
Yeah.
Absolutely. Um, and that can be really tricky to
Sure.
navigate,
Yeah.
which is also why I like to always invite having the partner come in, even if it's just for a session or two,
Yeah.
just to get their side and understand where they're coming from. Because when I'm seeing someone in one-on-one, I clearly don't
Mhm.
know their partner and
Yeah.
what their experience is or why they might be saying no or what their thoughts are on that. Because I do have a lot of men who come in and say that my partner is anti-coaching or therapy and doesn't want to show up and
Mm.
is just thinks that they're fine. And so it can be really challenging for me to have to work with someone to navigate a partner
Yeah.
who's not open a lot in those spaces. And I all I can do is kind of my best um, understanding of what they might be experiencing.
Mm.
So I try to bring in like that understanding to my client and say,
Yeah.
you know, the way that they're reacting is likely a product of XYZ. Um, and that's understandable. And how can we navigate the best that we can with conversation by continuing to be curious, even when you get a straight up no, or I'm not into that, or why would you suggest that, or that's
Mhm.
gross, or whatever reaction may show up,
Yeah.
is trying to continue saying, okay, well, I want to understand more of why you reacted like that. What's happening for you? Um, and and going from there. So
Yeah.
there's in some ways there's sometimes a block that I hit because I don't get to see the other partner
Mm.
unless they come in. And so it's really hard for one person to take on all of that. But
Yeah.
we do the best that we can.
Yeah, and I
So
commend those guys for being brave enough and wanting their relationship enough to come in and see you, even if their partner is not supportive. That's
yeah,
amazing.
it is amazing. It
Yeah,
is. And I celebrate them every chance I get with doing
yeah,
that, because we need that. We need more men coming
absolutely.
and doing this type of work and it being accepted and
Right.
celebrated.
Absolutely. Do you find in your practice that you have mostly men, and then when you do the couples therapy, it's because your men client bring their partner in, or do you have kind of like a mix of couples who come together and men, and how does that work for you?
Yeah, so I think it's more the latter. I have a lot of couples that come in together, and um and then just men that come see me
Yeah.
individually, and um who have to work with um a partner that isn't really interested in doing this
Mhm.
kind of work. So it's actually been one of the most surprising things for me,
Hmm.
um, in this field, and just being a woman is so much of what we've gotten taught. A lot is that women usually push for these things, that they're the
Mhm.
ones pushing for couples work and things like that, and a lot of men are very reluctant to it. And I have found it to be quite the opposite in my line of
Interesting.
work, which has
Yeah.
really surprised me. So I no longer really believe in that stat of men don't like to do this kind of stuff and whatever, because I
Yeah.
have seen the opposite, where there's a lot of women and female partners that just are resistant
Hmm.
to it. So,
That is really
so
interesting because I would not have figured that.
yes, I same.
Yeah.
And when I first started this work, and I said I really wanted to work with men, and that was where I was kind of gearing my attention,
Mhm.
was couples and men. I got a lot of feedback around that. Like, oh, well, that's going to be really hard because men don't like to do this, and that's going to be really challenging. And it has been a really surprising um, changed for me.
Yeah.
So
Yeah.
I really kind of thrown that idea out the window. I'm like, actually, that's not true. At least in my experience, I have found a lot of men wanting a lot of help and support and in these areas, and just having
Yeah.
partners that aren't on board.
That's
So
crazy. It's so exciting to me because I love that we're getting there as a society to accept men's emotional side more and more, because it does need care and it does need nurturing. They need it as much as we do.
absolutely,
Yeah.
100%,
Yeah.
they do.
So I want to delve into orgasm dysfunction. So either premature ejaculation, delayed ejaculation, not from a medical standpoint, from your side of things, from the what can these guys do? Like I know I can help my guys with premature ejaculation by giving them some SSRIs, even though there's a host of side effects with those. We can help with, a promescent numbing spray. We can help with edging. We can help with some techniques that for some guys work and some guys don't. But I don't have the tools to help them work through the psychological side of that. And same with the delayed orgasms. These guys who can, they just have difficulty. And especially my older guys, maybe post prostatectomy or things like that, where things maybe just don't feel quite the same anymore. So there is some physiological component to that, but then their partner is getting upset because they feel like it's them, or they just don't really care about having sex as much anymore because they're not getting the big O. How do you help your guys work through orgasm issues?
Yeah. Well, this is so fun. Um, um, so I think I'm trying to think of the right word. Changing our perception on how we focus on orgasms, I
Mm-hmm.
think, is like one of the first steps. Is there That's always what the end result is supposed to be around sex.
Right.
It's that. And I think when we do that, there's a lot of pressure that gets put on that, whether you're coming too early or having a hard time coming at all. It's
Mm-hmm.
it's taking that kind of away, which definitely takes time
Yeah.
to break down those ingrained thoughts that we have, and working
Mm-hmm.
from a place of what feels good,
Mm-hmm.
what sensations in your body feels good, what do you like, what feels pleasurable. That doesn't mean you have to show up and perform in this certain kind of way where orgasm is the one and ultimate goal. it is
Mm-hmm.
it is working with other things that provide pleasure,
Yeah.
essentially, and breaking that down. And that's really the gist of what I do, is using tools and techniques and learning how to get men in their bodies as well, which is a
Mm-hmm.
whole other thing that I
Yeah.
spend a lot of time working with, because a lot of men are like, what are you talking about? Like, 'cause we're
Yeah.
very much in a society, especially men, where we live in our heads and we
Mm-hmm.
disassociate from our bodies completely. And
Yeah.
so we don't uh, we don't so much in the bedroom, we get more in our bodies, but
Mm-hmm.
a lot of times it's still a very logical, we're in our head space of like, okay, the goal is to please her and get off. Okay, cool.
Yep.
Those are the main
Check the
goals.
boxes.
Check boxes, exactly. Instead
Yeah.
of let's let's stop and pause and like change the goal of what we're looking
Yeah.
for here. And it's finding what touches feel good, what visual things feel good.
Mm-hmm.
And I bring in what I call working with your core desires.
Okay.
And essentially, a core desire is what someone wants to feel
Mm-hmm.
during sex.
Okay.
So the feelings that you want to have. So if you want to feel desired, if you
Mm-hmm.
want to feel dominated, if you want to feel, um, there's like such a host of different things. And a lot of
Mm-hmm.
things, we have a very small box that people fit into. So it's like desired is accepted and wanting to feel good is accepted. And yet some people really get off on feeling ashamed. They want
Mm, yeah.
to be put in a position where they can feel embarrassed or shamed or um, submissive or
Sure.
all of these
Controlled.
things. And I have a whole
Mm-hmm.
list of things that I help people understand what that is. So first is like
Okay.
understanding that about yourself. Like, what do you want to feel?
Mm-hmm.
And then I work on what I call your hottest sexual movie. So where you figure out what things, um, words, gestures, actions make you feel those feelings that you want to feel. So how
Hmm.
do you feel? What needs to happen for you to feel desired or wanted? What words
Mm.
need to be said to you that make you feel um, ashamed, or what things get you off? So working with those two things, um, and bringing that into play instead of just pleasing and orgasm. So
Mm.
really helping people understand those two concepts, which are very general in how I'm explaining them right now on this podcast,
Yeah.
but they're very in-depth things. And so much of it is breaking through a lot of the stigma and barriers around
Mm-hmm.
what people view as acceptable and not. Um,
Yeah.
and it's, uh, it can be really challenging work, but I think it's really, really important work. And the biggest thing about core desires that I think a lot of people struggle with is your core desires aren't things that you get to pick. They
Mm.
actually stem from your core wounds as children.
Okay.
And so the things that turn you on aren't things that you get to just pick. And
Mm.
so whatever that looks like, whatever that is, and it can vary so much of what that looks like. And
Mm-hmm.
I love helping people figure that out and then celebrating that without judgment and helping them go get that in consensual and healthy ways. And I
Yeah.
think that's the biggest part of, as you're talking about, like this, struggle with either
Mm-hmm.
coming too soon or not coming at all or struggling to come at all. It's
Mm-hmm.
working with those two things and focusing on pleasure and what really works for you and what is your unique thing, or
Mm-hmm.
things that help you get turned on and get aroused, and focusing more on the pleasure side.
Yeah. And I love what you said about people being able to feel good about what turns them on. So for example, like you brought shame and being controlled and things like that up. For some guys, I can imagine that that's very difficult to admit that
Yes.
they like that is
Yes.
what turns them on. And so being told that that's okay and it's not wrong and you're
Yeah.
not bad for
Right.
thinking those things and for needing those things to get turned on, I can just imagine must be like mind blowing for some of these guys.
Absolutely. Absolutely. And it's such a it's it can be a really challenging thing to break down a lot of that. And um it's one of the things that I'm most passionate about actually in this work
Yeah.
is, because we do live in a very, like, heterosexual monogamous
Hmm.
box, and
Yeah.
you're allowed to like certain things, and then so much of other things are very taboo and very hands off. And it's like, but this is a part of you,
Yeah.
and you get to choose this, and it's beautiful and wonderful, whatever that looks like. And sexuality is this very fluid thing. It's not this
Yeah.
black and white way of being. Everybody is so
Sure.
unique and different, and being able
And your
to help
needs
somebody.
change.
And they
You're
do. And they
Yeah.
do.
Different
Yeah,
phases of your life, you need different things.
absolutely.
You learn more about yourself. Maybe you've healed some of those childhood wounds, and now what you needed before, you don't necessarily need now, and now you need different things.
Right, right,
Mhm.
right. Yes,
Yeah.
exactly.
One of the things that popped into my head as you were talking, I'm not a man, but as you as you were talking through it, like what turns you on is I remember watching this movie, The Wedding Date, and Deborah Messing is in it, and I can't remember the man in it, but there is a scene. So she basically hires this guy to be her date. Okay, so
Yes.
he's an escort, right? But there is this scene where she's about to go into the bachelorette party, and he pushes her up against the car doesn't do anything but like get close to her neck and breathing and talking and telling her how beautiful she is and how successful she is and how she's better than any other girl there. And like, and watching her like come to and being like, whew, I need a minute. And that man did nothing sexual to her.
Yeah.
And that is one of the hottest scenes I have ever seen in a movie.
Yes. 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 And I would say that was hitting her core desires.
Yeah,
It
that's
Yes.
exactly what popped into my head when you said those core desires, because I love I love being told I'm pretty. I love being told that, you know, you want me, things like that.
Yes.
And that will do more for me than you constantly touching me and stuff. So it's interesting when you're bringing up these core desires, like really thinking through, when do I get turned on? What are those things that really get me more than, you know, and it's not necessarily the typical things that we think of, touching the genitals and, you
Right.
know, making out. It can be so many different things that get you ready.
Yes. Yes. And that's exactly it. That is exactly it. I love that you just shared that story, because I'm like, yes, 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 that's exactly
Yeah.
right. There's such wide, um, a wide variety of what that looks like. And we don't really get taught to spend time thinking about that. Like, what is
Yeah.
that really? What really does that for me?
Yeah.
And a lot of times people are afraid of sharing what that really is.
Yeah.
And you bring up The Wedding Date, which, by the way, I love that movie.
Great movie.
Yes. And one of my favorite things to bring up is the show Billions. And I don't know if you've
Okay. I
seen
have
that
not seen
show.
that. No.
Um, Excellent show,
Okay.
but has a Paul Giamatti is one of the main characters in it, and
Okay.
the first scene of that show shows him on the floor being dominated by this
Hmm.
woman who's all dressed up in this dominatrix thing, and she urinates on him.
Okay.
And I remember watching this scene going, oh my God, yes, he's getting his core desires met.
Yeah.
Where, and you find out like it's his wife in the show that's
Yeah.
performing that. And, you know, where a lot of people would be like, oh my gosh, that's so gross, or, you know, have all these
Right.
judgments around it. Now, you know, being urinated for me is not something that would turn me on,
Yeah.
but it is a thing
Right.
that does turn people on. And my
Mhm.
job is to say, oh my gosh, that's amazing and awesome. How do we
Yeah.
help you go get that out in the world? How do we celebrate that about you? Because you can't control that. That is a part of you. And I think
Yeah.
that's wonderful. So I remember watching this scene with my former partner, and it was like, yes, he's getting his core needs met. That's amazing. And again, that's
I
like
love
one of
it.
those taboo things where people
Right.
have judgments or thoughts around that, and they're
Oh
like, oh
yeah.
my gosh. But there's probably a lot of people that really enjoy that or would get aroused by that, but would
Yeah.
never be feel safe to share that or admit that.
Sure.
And there's a whole realm and a whole world out there where those are things that you can go and have done and get and your needs met in that way. And I just think
Yeah.
that's beautiful. So like two very different kinds of scenes there, but
Right.
the whole goal, like the whole thing is
Yeah.
those are two different kinds of core needs being met.
Absolutely. Absolutely. And I love that there are so many varieties of what pleases any of us, because you can find someone who is open with that and who's willing to.
Yes.
And my bottom line with my patients is, and I'm sure with you as well, is as long as it's consensual and nobody's truly being hurt or threatened, to the point where like you're ending up in the hospital, right?
Right.
You know, then go for it. Explore what you want to explore. But for me, the
Absolutely.
consent part is huge.
Yes. Yes, it is.
Yeah.
Absolutely. It's
Yeah.
got to be in a safe, consensual way with two adults that want that.
Yeah.
But yeah,
Yeah. If you just
absolutely.
start peeing on me, we're going to have a problem.
Yeah, absolutely. Absolutely. Yes. Yes.
If we have decided that is something we're going to try, that's another thing. But if I just
Absolutely.
wake up and there you go peeing on me, we're done.
Yeah. Absolutely. I get it. I totally get it. Yeah.
So
So,
great. Any other things that men come to you for, or that we haven't covered yet today, that you really want to get out there and let our guys know that they're okay, they should come see you or someone else, or anything that we haven't covered yet today?
Really nothing specific, but outside of just if you're looking for help, if you want it, if anything in this episode resonated with you, or any of the episodes really, if you're a man, please don't let the cultural, societal messaging and things stop you from doing that. There is a whole world out there to help you and support you in all these different ways, whether it's, learning how to communicate with your partner better, if you're fighting a lot, or just being able to express yourself in different ways, to, owning your core desires and figuring out what that is and how to get more of the sex that you're looking to get. So that's really it. I just want to help support men and people in general anyway.
It's amazing. This conversation has flown by. Like, I can't believe we're already finishing up here, but it's such a great conversation. Charlotte, if people want to reach out to you in particular, we can include things in the show notes, but how do people get in touch with you?
Yeah, so I mainly spend most of my time on LinkedIn. Okay. So you can just find me by Charlotte Bevers on LinkedIn. My headline is Sex and Relationship Coach. I'm also on Facebook and Instagram as well, and I have a website, which is asatiliving.com. And
Yeah, so we'll put your links in the show notes when this goes live, so people can find you if they want to. And if they're not in your local area, do you do online sessions as well, or are you just in person? Okay, awesome.
Nope, I do online work, so I can see anyone from anywhere.
Awesome. That is so exciting. I have loved this conversation. Your energy is amazing. I love how much you want to help our men and their partners have the best sex ever, because that is just really, it's beautiful, and it's my goal in life to help people get there and to feel more comfortable about talking about it too. So I just thank you so much for being here today.
Absolutely, Stephanie. This was amazing. I had a lot of fun with you as well. So thank you so much for this opportunity and for the conversation.
Absolutely. Absolutely. Everybody take good care. Go have some great sex, and we'll see you next time Between the Sheets. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthe.sheets@gmail.com. That's all one word, podcastbetweenthe.sheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can follow, and share this podcast so they can see it too. See you next time for more sexual health topics Between the Sheets.